Vulvodynia encompasses a lot of different types of pelvic pain, but most commonly it involves pain at the vaginal opening with intercourse, the use of tampons, pelvic exams, but it can also go externally throughout the entire vulva. The cause of vulvodynia is more unknown just because it can be so different for each person, but a lot of the issues could be nerve compression or pelvic congestion and other things like that. Pelvic floor muscle overactivity is a really common cause of pelvic pain. What happens is the muscles get really overactive, and that causes decreased blood flow and more inflammation in those muscles, which can cause referred pain within the pelvis to the sacrum, the low back, and the hips. Pubic symphysis pain is the result of a little bit too much movement at that joint. So we see this really commonly during pregnant and postpartum women, just because they tend to have a little more mobility at these joints, and that causes pain. There's also a lot of pelvic floor muscle attachments to the back of the pubic bone, so sometimes overactivity in those muscles can result in pubic bone pain as well. Pelvic pain caused by pelvic alignment issues is usually the result of too much mobility at the joints within the pelvis. So that includes the pubic symphysis and also the sacrum and the SI joints. And so you want to have a little mobility there, but when the joints are moving too much, that can tend to cause issues with pain and instability. Nerve compression can occur in the low back and as well as the pelvic floor due to pelvic floor muscle overactivity, and it causes impingement or irritation of the nerves in that area, leading to widespread kind of generic pain throughout the pelvis, sometimes the low back as well. Perineal scar tissue is another source of pelvic pain that we commonly see in postpartum women who have had vaginal deliveries. So this scar tissue is very highly innervated and can cause a lot of pain with friction, such as like during intercourse, or even just by causing increased tone throughout the pelvic floor muscles.